Hello, this is Dr. Joseph Shumelian, President of the Australasian Society for Conservative Implant Dentistry. In this video, I'd like to discuss the modern methods for the replacement of missing or extracted teeth. There are a variety of techniques that have been made available over the decades, and the current options are, firstly, a removable partial denture. A partial denture can be made in an acrylic or in a chrome framework. They are removable, as I mentioned. They're unnatural, in that they sit on the gum and not in the gum, as natural teeth do. Over a period of time, they may damage adjacent teeth, and of course, being acrylic, they are subject to breakage. The metal version is preferable, however, it is still removable and somewhat unnatural. The second option that one can consider is a non-removable bridge. It requires the permanent damage to adjacent teeth, the reduction of those surfaces so that a bridge can be placed on top of the teeth adjacent to the gap. It is of course not possible if the gap is too big, and not possible if there's no back tooth. You can imagine if you're missing the molars, there would be no way that you could fit a set of teeth in this manner. For the last 30-35 years, we've had a technique which we've termed the conventional implant system, and it requires surgery. Now, these conventional implants are fairly wide. They're anywhere between 3.5 to 6.5 millimeters in diameter, and they require a surgical approach and removal of healthy jawbone in order to accommodate these wide titanium implants. They do require up to about 6 months for healing, and they are very complex in the componentry that is required. They often require additional bone grafts if the jawbone has shrunk, if it's resorbed, and the fee range can be quite dramatic, between $5,000 and $10,000 for each individual tooth. And it does take the best part of 6 to 7 months for the final outcome to be delivered. So that too is something that our society isn't recommending. What has been wonderful over the last 10 years is the advent of keyhole techniques. Just like keyhole medical procedures, in dentistry and dental implant procedures, we also have keyhole techniques when no surgery is required. It is minimally invasive. You end up with immediate results, and a temporary tooth can be placed on your gum immediately at the first visit. Much simpler componentry, as you can see, and there are no bone grafts needed, and the fee range is that much less, $2,500 to $3,500 per tooth. In comparison to conventional implants, you can see in these diagrams, there's a surgical placement of the implant requiring the incision of the gum, drilling of the jawbone to create the implant site, and insertion of the implant. Suturing of the wound is also required afterwards. About 6 months later, the gum has to be reopened so that the implant can be accessed, and sections called abutments are placed within the implants, onto which porcelain crowns can be cemented. So what actually is keyhole implant dentistry? Well, as you can see from this picture here, it's a small 1 millimeter, in fact 1 millimeter to 1.5 millimeter diameter access through the gum, into which an implant is inserted without the need to remove healthy bone. The implant is self-advancing, it enters the jawbone and stays there very securely. As you can see in this picture here, 3 little implants can be placed in this back region of the upper jaw to carry 3 artificial teeth. Much better than having a big chrome plate in your mouth. There are no incisions, no stitches, immediately can carry temporary teeth, and the permanent teeth can be attached just a few weeks later, not 6 months later, but just a few weeks later. Total treatment time for such a procedure is about 2.5 hours. An international authority by the name of Dr. Gordon Christensen from the United States made the following statement regarding mini implants, which are basically the precursors to what we are now calling small diameter implants or keyhole implants. Basically, the more patients have been served successfully at reduced costs with minimized pain and trauma, patients who could not have been treated with implants otherwise. This technology is allowing more people to enjoy the benefits of implants at reduced rates and with virtually no pain, with very high success rates than any other technique. As you can see from this graph here towards the right hand side of the screen, you can see the success rates are around the 96% mark for non-removable replacements of missing teeth in the upper jaw and the lower jaw. A study of 5,500 implants was carried out over an 11-year period in New York, and these are the findings. 96% are there, serving beautifully. So in replacing teeth, here's a typical example for you. Many patients have the misfortune of having to wear a large chrome plate for the sake of having one replacement tooth such as this. And it's really a shame to have all of that in your mouth. So the techniques that we recommend really are superb in the form of the placement of a single little implant, as you can see on this x-ray, placed within the jawbone and then carrying a porcelain tooth. That's a world of difference from the gap that existed there and the need to wear a large chrome framework denture. Treatment time is around 90 minutes for this procedure, and it's a life-changing service that we provide. Many people are missing a side tooth, often where the smile ends, and marring their ability to express their full personality. So the placement of a single implant like this, as you can see, is quite minimal. There's no cutting of the gum, there's no stitches, and the final tooth is positioned within 2 weeks and can look absolutely completely natural. Often people are missing large numbers of teeth, as you see on this particular image here, and with that large bulky denture, there's only one way this upper jaw can go, and that's downwards, downhill. The back teeth would eventually need to be removed, but you can see here a very large number of teeth, maybe about 10 teeth missing, but the outcome, instead of having to have a big lump of plastic or chrome in one's mouth, the outcome is a set of beautiful porcelain teeth, non-removable, and completely leaving the palate free of any obstruction. There are no plates, no metal retainers or wires to secure this. These are all secured by a series of keyhole implants placed painlessly within the gum. The other technique for the other benefit of these type of implants is to stabilize lower dentures. Here you can see the artificial lower set of teeth, and it's secured by 4 implants placed in the jawbone, and these are connected to the denture using a metal housing, as you can see there. Take that away and you can see that there's a little O-ring, and that O-ring connects around the implant head to stabilize what is very often a very loose lower denture and creating a miserable situation when trying to eat. This presentation was brought to you by the Australasian Society for Conservative Implant Dentistry, and here's the phone number if you'd like to find out more, 1300 966 663. And if you'd like to send an email to the Society with your particular query, please send it to ascidinquiry@gmail.com. I hope you've enjoyed watching this video and learnt substantial to help you on your way to a far better, healthier, happier dental situation. Thank you for watching.